former Deputy Health Minister, Dr. Lee Boon Chye, accused the government of failing to protect Malaysians against imported cases of the highly contagious South African variant. Lee told FMT that the number of imported variants was likely to be far higher than reported because the Health Ministry was carrying out genomic sequencing in only a few selected cases. He said that some vaccines, such as the AstraZeneca vaccine, were ineffective against the South African variant, and others, like the Pfizer vaccine, had limited effect. He called for improved monitoring of the strain and enhanced preventive measures at all points of entry into the country. Effective contact tracing of every new case of COVID-19 should be done so that each case will not evolve into a huge uncontrollable cluster of infection, Lee said, and added, the virus can be contained if every close contact can be identified, tested and isolated within 48 hours. Dr. Sanjay Rampal, an epidemiology specialist at University Malaya, told FMT that mutations were likely to be spread in any country without strong border controls. The current quarantine guidelines in Malaysia are sufficient, he said. However, implementation needs to be standardized for all travellers. Sanjay said there was a need to adjust expectations to acknowledge that there would always be a baseline risk of COVID-19 spreads. In my opinion, he said, there has been continuous genetic characterization of samples over time by the labs. There may be room for more data transparency.